Hey there, RNs! In this video, I am going to teach you 6 strategies on how to answer board exam tricky questions. So without further ado, let's jump into the video. Here are some tips to help you stay focused and avoid choosing the wrong answer, okay? Number 1, skim the questionnaire for 10 minutes. So ano ba yung benefit nito? When you skim the questionnaire from 1 to 100, this will prepare your brain for the upcoming topics. When you scan your paper from 1 to 100, nape-prepare na yung utak mo na, oh my God, there's HIV questions. Oh my God, there's like hepatitis questions, my liver questions, my colostomy care questions. Alam niyo yan? So, na-prepare na yung utak natin. You can also find clues sa ibang numbers, especially if, sa number 40 pala, colostomy care. Tapos sa number 1, ganun din yung question. So parang pwede mo siyang mapagtagpi-tagpi na, I can find clues here in other numbers. Ganon. So you have to skim your questionnaire from 1 to 100 for 10 minutes lamang. Tingnan mo lang kung ano yung mga topics na ma-expect mo. Ganon. This will prepare your brain for the upcoming topics and it will help you more relaxed, more calm kasi alam mo na yung what to expect. Diba? Number 2. Read the question and formulate your answer first before reading the choices. This will give you an idea of which options is already correct. Halimbawa, a client with diabetes mellitus reports feeling shaky, sweaty, and lightheaded. The nurse suspects hypoglycemia. Which of the following should the nurse instruct the client to drink first? Now, using your own critical thinking and idea mo, masasabi mo na, okay, hypoglycemia, mababa ang sugar. For diabetic patients, we all know, dapat nating ibigay is orange juice. Kasi nga, mababa yung sugar nila, so dapat bibigyan siya ng orange juice. Orange juice is the best choice. Tapos ngayon, babasahin na natin ang choices. A glass of water. B, diet soda. C, a half cup of orange juice, or D, a cup of black coffee. Dahil meron ka ng sagot sa utak mo and you find it in the choice, super easy na lang siya, diba? So the correct answer is C, orange juice. Read the question first, then formulate your answer before reading the choices. Number 3, never ask, what if? Ito din isa sa mga pinakakalaban natin guys sa board exam is yung over-analyzing and asking, what if ganito ang mangyayari? What if ito yung pipiliin ko, ito yung mangyayari? No! Stop doing that. Never ask the question. Never make up scenarios in your head na what if ito yung mangyayari? What if ito pala yung meaning niya? Answer what is being asked. Isa sa mga helpful guys na tip you should be asking yourself is this. Are they asking for an expected outcome? Are they asking for side effects of the medication? Or are they asking which is unexpected from the disease process? Yun yung mga tanong na dapat mong tingnan sa question at yun yung tatanong mo sa sarili mo. Para when you read the choices, alam mo na yung sagot. Never ask what if, just ask yourself ano yung tinatanong. Baka yung tinatanong lang sa'yo, what should you do? Or ano yung priority mo? In prioritizing questions, guys, always remember ADPI, ABC, and Maslow's hierarchy of needs. Number 4, and a very common, guys, you have to eliminate choices. For example, the nurse is caring for 4 clients on the medical surgical unit. Which client is the highest priority for the nurse to assess? Now remember, prioritization question. So I have to think of number 1, safety. Number 2, ABC, airway, breathing, circulation. Number 3, ADPI, assessment, diagnosis, planning, intervention, evaluation. Maslow's hierarchy of needs. Ano yung Maslow's hierarchy of needs? Basic needs first, tapos psychological. Remember that, okay? Basic needs first, food, shelter, safety, before psychological, like love, belongingness. Gets ba? Uunahin mo talaga yung mga basic needs, water and food. Going back to the question, which client is the highest priority to assess first? A, Mr. Lopez, a client with pneumonia, reports mild chest discomfort when taking deep breath. So, meron siyang mild discomfort. Pwede siya, di ba? Pwede naman siya. So, mas-skip tayo sa B. Mrs. Carter is diabetic client who needs teaching on self-administering insulin. Is teaching a priority? Highest priority ba siya? So, i-eliminate na natin si B. Kasi nga, teaching lang naman yan eh. That is not a basic need. Remember Maslow's. So, B is eliminate. We have to eliminate. We have to crush it out. Para at least, psychologically guys, masasabi natin na B is wrong. Papalapit na tayo sa tamang sagot. Gets ba? So, we have to eliminate. C. Mrs. Lee, a client with chronic renal failure, is requesting assistance for ambulation. Ambulation, niya lang medyo tumayo. Is that a priority? Hindi. It doesn't really tackle the basic needs or the need for safety. So C, eliminate na yan. Letter D. Mrs. Smith, a post-operative client, reports sudden difficulty of breathing. Difficulty of breathing. Prioritization principle, ABC. Airway, breathing, circulation. So, ang dalawang choices natin is A and D. And they both talk about breathing. Pero alin yung pinakamas lala, guys? Which one do you think is the highest priority? Difficulty or yung mild chest discomfort lang when taking deep breath? Alin? Alam mo na yung sagot, guys. Of course, ang pinaka-priority natin is always the difficulty of breathing. So, D is the correct answer. We have to eliminate A. Yun. So, eliminate para at least mabilis na lang siya mahanap yung tamang sagot. Number 5. Remember the keywords. Keywords are the most important aspect, guys, of every question. Alam niyo kung bakit? Tandaan, guys, the keywords change the entire trajectory of the question. Ang keywords mismo yung nagpapabago ng question. Sa totoo lang. Be careful not to miss them in every question. Halimbawa, a client with a history of bipolar disorder is admitted for lithium toxicity and is displaying symptoms of severe tremors and confusion. Initially, what is the nurse's priority action? So, ang tanong is, nurse's priority action. Ang priority niyan sa lithium toxicity kasi ang lithium toxicity, it can cause kidney failure. So, dapat isave ko yung patient for kidney failure. So, dapat may mga preventive measures ako. Hahanapin ko na sa choices. A. Supportive therapy for possible lithium toxicity. Oh my God. This is it. Ito na yung tamang sagot. Pero basahin ko muna yung B and C, D. Hold the dose o lithium, hindi yan. Monitor vital signs and obtain stat lithium level. Prepare for the client for hemodialysis if ordered. Pwede naman siya, pero ang priority ko talaga is supportive therapy kasi nga, toxicity na eh. A is actually wrong. Kasi kung babalikan mo sa question, merong keyword kayong na-miss. The word initially. Initially means first. Una. Ano yung una mong gagawin? Initially, what is the nurse's priority action? Initially, una mong gagawin. Prioritization action, add PI. Ang first palagi sa add PI is assessment. Add PI, assessment, diagnosis, planning, intervention, evaluation. Initially, we assess. So, actually, tamang sagot dito is C. Monitor vital signs and obtain stat lithium level. Kasi nga, initially, yan yung priority. Diba? Gets ba? Although, sinabi dito priority action, pero may keyword, guys, na initially. So, ang initially, yung nagpapabago sa trajectory ng question. So, you have to keep looking for keywords. So, here are example of keywords, guys, to look for sa mga questions. We have early sign, late sign, best, first, most likely, highest priority. Also, we have the negative keywords like least likely, avoid, ineffective, unable to tolerate, or needs reinforcement. So, yan yung mga keywords that you have to look for. Kasi, binabago niya, guys, yung question. Okay? So, be careful with the keywords kasi it can make or break the question. And last but not the least, guys, number 6, know the issue of the question. Isa sa mga favorite ko, guys, na discovery ng board exam ako is the difference between adverse effects and side effects. Halimbawa, a client taking clozapine clozaril for schizophrenia presents to the clinic with complaints of sore throat, fever, and general fatigue. The nurse monitors the client for adverse effects of the medication. Is it A, weight gain, B, drowsiness, C, agranulocytosis, or D, dry mouth? Laging tandaan, nurses, Adverse effects versus side effects. Adverse effects, unexpected, usually malala. Side effects naman guys are expected effects of the medication. And these are usually mild symptoms. So sa tatlong to, alin dito yung pinaka-bad? Of course, it's agranulocytosis. Clozapine clozaril can cause agranulocytosis. It can cause fever, sore throat, malaise, or body fatigue. And that's it guys. Those are the 6 strategies I use during the board exam, especially in answering tricky questions. Stay safe everyone, and you will become a registered nurse.